Good afternoon, everybody, and happy Friday. Thanks for joining us. Today we're going to be talking about chemotherapy and the coronavirus. Briefly, I will introduce myself. I'm Lacey Stickell. I'm the oncology nurse practitioner here at the Moss Memorial Campus. I'm a graduate of McNeese State University, a longtime resident of Lake Charles, Louisiana. I did move away to Texas for a few years and work, but then came back here to my roots. I'm currently a member of the Memorial Cancer Committee, and I'm the coordinator for our new survivorship program, the founder of Southwest Louisiana's Oncology Support Foundation. I'm also a mother to a small herd of little girls and a wife, as well as a patient advocate for cancer patients here locally. So we were asked today to talk about the coronavirus because that's the new hot topic. We're going to start with just some brief topics about corona and who's immune compromised. So that's who we keep talking about should be concerned. People with a compromised immune system. A lot of people say, well, who is that? Am I that? So as most of you know, cancer patients that are undergoing active chemotherapy treatments are immune compromised. Our elderly population tends to be a little more immune compromised due to their comorbid conditions and their multiple medications. If you have a history of an organ transplant and you're on immunosuppressants, things like lupus, rheumatoid arthritis, those patients are oftentimes on immunosuppressants. Patients that have HIV or AIDS, sickle cell disease, or anyone else that's on an immunosuppressive therapy. I think we've all heard of COVID. We all know that COVID is a virus that can affect your lungs. So I don't feel like I need to go into big detail about that. But that's what we're talking about. Then just some updated statistics. I put these together on Wednesday, I believe. As of Wednesday, we had 51,000 plus cases in Louisiana with 3,000 deaths. 7% of the COVID cases in Louisiana, those patients had underlying cancer diagnosis. And then recently we reported 1,356 new cases in a 24-hour period from the 22nd to the 23rd in Louisiana alone. That was our third largest single week increase in the cases. Our hospitalizations are just now beginning to rise again. We had got down to nothing, but we're slowly climbing. But we're told that we're nowhere near capacity and it's not of a great concern right now. So how does COVID spread? You've probably heard 100 times coughing, sneezing, things like that. Other things to keep in mind is if someone coughs, sneezes, has a runny nose, and they're handling a pen, then you touch that same pen, and then for some reason, after you've touched it, you touch your eyes, mouth, anything like that, which happens often in a doctor's office. You go, you check in, you touch the pen that everyone else uses. So those are things to think about. When you're grocery shopping, touching the grocery buggy, touching things on the shelves. We know now that this virus can live on objects for a prolonged period of time. One of the newest things I read about that I found interesting is karaoke is one of the highest, people transmit the highest viral load when they're singing because it's loud, you're usually in a big group. Those people aren't feeling bad, but they may have asymptomatic COVID and they're just spreading it to everyone around them who's watching the karaoke or joining in with them. So specifically what I'm going to talk about is what we need to know and what my patients need to know who are undergoing treatment for cancer and why is it important to us. So a lot of times I have patients that will say, how can I protect myself? What should I do to help prevent from getting COVID? A lot of this I know you guys have heard a million times, but I'll just give you a little more detail. Washing your hands with soap and water as often as possible, and you need to be washing your hands for 20 seconds, not just a quick pass. Everybody's heard the saying, sing happy birthday to yourself while you're washing your hands. When you're not at home and you don't have access to soap and water, carry hand sanitizer with you. It needs to be at least 60% or more alcohol, and it says it on the back of the bottles. And use that as often as possible. If you're at the grocery store, put it on before you touch the buggy. Put it on throughout your trip through the grocery store so that way you're more conscious of you're touching things and not touching your face. Absolutely put it on when you're done grocery shopping and when you're leaving, as much as possible. Try to avoid touching your eyes, nose, mouth without washing your hands prior to that. It's hard. I think it's a subconscious thing that we all do, but we need to be more conscious and mindful of when we're touching ourselves. Clean and disinfect surfaces as often as possible. Your regular household Clorox wipes, clean those. You want to, at your house, clean the doorknobs, clean the light switches, clean things that you don't typically think of cleaning, but that are high traffic objects. And as hard as it is, avoid handshaking, hugging, or standing really close to people unless they're in your immediate household and living with you. And then, as always, be as healthy as you possibly can. And later on in the presentation, we'll go into some details about things that you can do to help improve your health. You also want to be sure you're staying away from anyone who appears sick. They may appear as though they just have like a little sinus allergy type thing, but that's what the majority of people who have COVID are experiencing, is mild sinus allergy type symptoms. A little runny nose, a cough, maybe some watery eyes, sneezing. Try to avoid those people. Don't get too close to them. Wear a mask when you go out of your home or when you're in a crowded area. When you're exposed to anyone that's not your immediate family. Keep 6 feet away from people who aren't living with you. If you're going to go to a social gathering, a graduation party, birthday parties, if possible, try to be sure you're outdoors and stand 6 feet away from people. You don't want to crowd yourself into a small area with a bunch of people, especially if you're immune compromised. Limit your visits with family members. So, and this is something I always tell my cancer patients from day one, COVID or not, you're going to be immune compromised. You're going to be at risk for getting an infection. So the best thing you can do is limit your exposure to other people, because many times someone could have a common cold, and that's much more deadly for a cancer patient than it is for the general public. People with a common cold don't really think about how that cold can impact others. So it's important that you stay conscious of it and limit the amount of time you're around anyone that's not in your immediate family, in your household. Try to limit the trips that you're taking to the store. If you could buy things in bulk, maybe, so you're not having to go to the store every day to pick something up. Make a list. Get it together and know what you need for about a 1-month supply. The less amount of times you're being exposed to the public and to all the objects that have been contaminated, the better your chances are of not developing COVID. So just stay home, but maybe go outside, get some fresh air and go for a walk. Something important that I think we need to cover is information for caregivers. 90% of patients are not going through this alone. They have someone else that's helping take care of them. So what do the caregivers need to know? What do you need to be sure your caregiver knows? There needs to be a contingency plan. It shouldn't be just one person always responsible for helping you do your visits, reminding you of your appointments, remembering to help you with your medications. That person should have a backup in case they were to become ill. It doesn't interfere with your ability to get the treatment you need. Your scheduled appointments. A lot of times we put those into our phones, but be sure that we have written and printed out scheduled appointments as well. So if that person comes down with COVID or something like COVID and they can't bring you, you have the backup with all the schedules for the next person who's going to help. Your caregiver should always wear a mask with you. They should want to protect you if they can. So the mask isn't always about protecting the person, it's about protecting your neighbors and everyone around you. Caregivers should always keep hand sanitizer safe and close, so that way they can take all the same precautions as you. Limiting their exposure to COVID is going to help prevent you from getting COVID. And then, as always, caregivers need to continue to advocate for the patients. You be the people that are going to say, no, sorry, you can't come visit, you have a cold. No, sorry, you can't come visit because you were just at a birthday party last week with a lot of people and we just don't want to take those extra risks. Sometimes the caregivers have to speak up and help the cancer patients keep people away, because it makes everyone uncomfortable to have to say no, but if you have that backup person that's there to support you and help say no with you, then it'll be easier. So we're going to move on to discussing our mental health. We talked earlier about staying healthy during this. Some of the ways that we could stay healthy is to protect our mental health. With everything that's going on right now, you're getting lots of information on COVID, coronavirus, the pandemic. Every time you turn on the TV, the internet, you open a newspaper, you're going to get some form of information. You need to verify the information that you trust and verify the information prior to passing it on or sharing it. Don't just share something that you read, because that creates additional anxiety and stress for everyone. Be sure that we're only looking at factual, evidence-based information. Stay up to date on the policies at your treating physicians and doctor's offices, because maybe they're going to require a mask, that you have to have a mask to get in the doctor's office. Well, you want to know that before you get there, because you show up for an appointment, you're ready to go, you don't have a mask with you, then that creates chaos and additional stress for you because you weren't prepared because they send you home. Don't alter your treatment schedule or treatments without consulting with your cancer team first. Don't let your fear of this take control and stop you from coming to your appointments. And follow the latest guidelines by the CDC and your local health department. They put out information almost daily. It's ever changing. But we have updates and conferences almost daily to help update everybody to what we know for the new standards. So some ways to help you manage the distress that you may have. So get more involved in physical activities. Take walks. If you're in good enough health that you can jog, by all means, jog, swim, get outside. Connect socially with others. So yeah, social media helps as long as it's not too much. Pick up the phone and call someone. Talk with others. Visit with people outside. Play online games with friends to help you connect and feel like you're connected socially. And engage in pleasurable activities. It's been safe to go to the beach, go fishing, go hiking, go watch birds. Being outdoors has been proven that it's safe as long as you're not crowded close with someone and touching things that other people commonly have touched multiple times over and over that haven't been cleaned. Other ways to make sure that you're managing your distress is with your diet and sleeping habits. You want to eat several small meals throughout the day, healthy meals. Limit the amount of caffeine you intake. That's going to make it hard for you to sleep if you're intaking caffeine late in the afternoons or too much caffeine. Sleep at consistent times in a quiet, dark room. Try to disconnect from social media and electronics an hour or two before bed. Otherwise, it doesn't give your brain that opportunity to slow down and rest, to put you into that restful mode. Try avoid taking long naps in the day. It's okay to take a little short nap here and there, but maybe not a long nap. So set aside time throughout the day for mindfulness, to be able to just think. Surround yourself with other positive people who are there to support you. Just pay attention to what you're doing and the way you're feeling. Don't let yourself just get so bogged down with the stress of all of this that you're not detaching and just taking a break and relaxing. It's important that we do that. So in summary, to help with our mental health and managing our distress, we need to be sure that we're up to date on the most accurate information and that it's factual information. Decrease your stress levels can also improve your mental health. And overall, when our mental health is better, our physical health will be better. And then improve your resilience. Maintain your optimism. Stay positive. Stay around people who are positive and keep you in that positive mindset. Keep up your sense of humor. That's always important. So what can you expect from your healthcare providers and your cancer team? the vast majority of us, you can expect that we will be wearing a mask when we treat you. Our goal is to protect you. We have to see multiple patients throughout the day. We never know who has what. So the best thing we can do is put our mask on and hope that it protects you guys. Your treatments will continue, hopefully without delay. Even when we had the stay-at-home order, we continued to give cancer treatments. We did not delay those patients. Some surgeries were delayed, but we took new and alternative routes to getting cancer patients on treatment. Maybe you couldn't get the surgery, but we started you on the medicines to help prevent the cancer from spreading prior to getting that surgery until we had the all clear by the government to start back with those surgeries. Your facilities are going to be flexible. We're going to work with you. We understand that this is uncharted waters for everyone. None of us really know the 100% right answer to give you about it, or what should be done or shouldn't be done. But we're going to work with our patients to make sure that they feel safe in the care that we're providing them. We're always here to answer your questions and guide you through this. I say that your cancer team is probably your best resource. If you hear something, read something, and you question it, is this actually factual? If it's going to change the way you live your daily life, call and run it by your care team. Most importantly, you can expect that we're human just like you. We don't know there is everything to know about this, but as this changes, we're going to navigate through this new normal with you and help you become more comfortable with your treatments. In summary, what we know the best ways to prevent yourself from getting COVID is wear a mask, wash your hands, and social distance. If you can, don't go out and about in large crowded places. I know I'm repeating myself, but that's the most important thing, is staying in a more outdoors, wide open, socially distant environment. Don't sit on top of each other if you're going to a sporting event. Bring your chair and sit along the sidelines further away from people. If you're going to your doctor's visits, wipe down the elevator buttons if you're going to touch them, or immediately use hand sanitizer after touching a button in the elevator. If you use a pen that multiple people have used, wash your hands with hand sanitizer. Try to stay safe. Practice social distancing. And finally, the last thing is to always stay positive, stay healthy, and keep a good attitude. If anybody has any questions, I know that the live stream has been going, and we are here to answer your questions for you.
Yeah, we've got a couple questions. The first one is just asking for clarification. So the mask, it says even if the mask doesn't prevent us from getting the virus, it does help reduce the infectious dose. Isn't that correct? Or asking if the mask is keeping us from getting it?
Yes, the mask is absolutely going to help us prevent the spread and prevent the amount of droplets that we're taking in, as well as the amount of droplets that someone could be putting out if they have COVID and they're asymptomatic. They may not even realize it.
Is it possible to get the virus from drinking after someone, or is it primarily from air?
It's said right now that you shouldn't get the virus from eating foods that other people have handled. I would say, and like I always tell cancer patients, I'm going to speak to that, try not to share your drinks with people. You can get something other than COVID. You could get strep throat from sharing things. So I say don't drink after one another if you're immune compromised.
And then if you're outside and you're going for your daily walk or jog and you are 6 feet apart from other people, do you still need to wear the mask when you're outdoors? Or
I would say no. I think if you're going for your daily walk or jog and you're staying 6 feet of people, do not wear your mask. It may make it more hard to breathe for you and make you not be able to really enjoy that. And when you're outside doing that walk or jog, it should be enjoyable to limit stress and make you feel more comfortable.
Awesome. Well, that's it for questions, so thank you so much.
All right. Thank y'all.